Hello. This workshop series is brought to us by a grant in memory of Alex P. Morrow. Today's topic is voice care presented by Carly Bergey. She will talk to us about how the voice cords work, vocal health tips, demonstrate some warm-ups, and talk about how to take care of your voice. Carly is a speech-language pathologist certified by the American Speech Language and Hearing Association. She is also certified in the Lee Silverman voice treatment and Lessig Medicine resonant voice therapy. Please welcome Carly Bergey.
Thank you. Carly Bergey, FYI, for the record. So yeah, I'm so excited to be here. I was saying to Beatrice that I moved here from Denver, Colorado, about a year and a half ago, and Godfrey Daniels has been on my list of places to go, so this will be nice. Yeah, when we think about voice and health, I think the first thing I want to talk about as we introduce this idea is that the voice is in our body. We can't take the voice out, take care of it, put it back and move on. We have to take care of our body and we have to take care of our mental health. So when we talk about voice care and when I see patients who have voice complaints and problems, a really common thread is that it takes some time and it takes some attention to patterns, the way that you chronically talk, the way that you chronically stand, the way that you chronically breathe. So it's a really, I don't have to tell a room full of storytellers how amazing the voice is and how this really cool thing happens when we breathe and air comes out, it mingles with our anatomy and it makes a sound, and that's the way we tell the world who we are. It's the way we tell the story of our life day in, day out. Whether we are mothering our children and telling them to put their shoes on, again. My children are 2 and 4, so that is a frequent phrase in my life right now. Or if you are working in a business and interacting with people day in, day out. If you're standing up here and you're presenting a story, we need to think about our voice in addition to the words we're saying and how we're doing that. So I'm going to talk about, break that down a little bit. So the first part I'll talk about the vocal folds and the anatomy and physiology involved in speech and how we make our voice. I'll talk about some tips, so specific things we can do to take care of the voice and specific things we can do to take care of the body and the mind as they relate to our voice. And then also, like Charles, although I hear them calling you Chaz, like you said, give you some warm-ups, and I hope that we get interactive. So I'll definitely ask you to try them, and we can troubleshoot and fine-tune those a little bit, because I believe that most people would benefit from a warm-up of some kind. And people who use their speaking voice professionally or even in a setting like this that maybe is not your job but it's a passion for you, we don't think about warming up because we're not singing necessarily, but we need to warm up if we speak on any kind of frequent level. And most of you probably have something else you do during the day besides coming up here once a week or whatever. So how you use your voice day in, day out really matters. And after that, we will talk about some troubleshooting, so things to watch out for. If you are noticing some of these things I'll talk about, that might be time to go see a doctor and get some, help. So yeah, first breaking that down, the first thing I want to talk about is how your vocal cords actually work. So, hello, welcome. You have, I kind of think of this as 3 subsystems when you think about the voice. The first is breathing, so our lungs. We have vibration that happens in our throat, and then resonance. So when that air comes out, it travels through our vocal tract and bounces around. So I'm going to kind of break that down. So when we talk about breathing, first step to get our voice to work is we need to have air passing through them. And when we take a breath in, the thing that happens is your diaphragm, which is right under your lungs, it's kind of nestled here. When you breathe in, Hi. That is going to activate and expand. So if you all put your hand on your tummy and maybe one on your chest, when you take a breath in, notice what's moving. Ideally, you should feel something down here. Now, many of us might not feel that. We might feel that up here. And that's something that we would work on in voice therapy, because this kind of involves a lot of tension and a lot of effort. And this doesn't really fill our lungs with air. It just lifts our lungs up and down. But when we activate here and kind of think of an expansion somewhere else, our lungs are pulled down with it and they open. Creates a negative space, a vacuum, air comes into that, and it happens really efficiently. You don't really have to take a breath. When you activate that, your body senses what's going on and kind of does that for you. When you exhale that air, the air comes out your lungs through your trachea or your windpipe, and your vocal cords sit right on top of that. So if we were to, if I had a slideshow, if we were to cut you in half, you have two tubes in your throat. In the front you have your trachea, and behind that you have your esophagus. And your vocal cords sit right on top of the trachea. So if you feel your Adam's apple, they are kind of nestled behind there, and they face the back, so that there's two of them. They're shaped like a V, and that V points out. And they're actually really tiny. They could fit on my thumbnail, like an inch or so, maybe a little longer depending on each person, but they're tiny, tiny tissues. And they're muscles, and they're covered by a skin-like epithelial layer, kind of like the inside of your mouth, kind of a mucosal skin-like layer. And when you have that air pass through, the vocal cords go from being open, so when we're breathing, they're out of the way, letting air pass, and when you want to make a sound, whether it's laughing, singing, talking, they come together and they vibrate. And they vibrate anywhere between 100 and 200 times a second. So the sound of your voice, so the pitch of your voice, is going to be determined by how frequently they vibrate. And if you're singing, you may be going up to 600, 700 times a second if you're going really high, so more times per second, hertz. And if you're going lower, less times per second. So there's a lot of intrinsic friction in the vocal cords. When they do their job to make your voice day in, day out, it's a lot of activity for them to come together and vibrate that much. Now, the coolest thing I think about voice is that from the neck up, that's what really shapes the sound of your voice. In the same way that if you blew into a tuba versus a trumpet, you would have a different sound that comes out. The air is going into both, but that air and the sound wave that is produced changes based on the shape of the instrument. So, it's colored and going to be darkened or, dampened by the size of your tongue, your teeth, your oral cavity, your sinuses. All of these things affect the sound of your voice. So, again, when you think about the voice, you've got air, you've got that vibration that happens here, and then how that sound comes out and bounces around. It sounds really simple, and it should be, it's very logical until something isn't working, and then suddenly you're like, how do I not know how to breathe? Or why can't I, get the sound to come out easily? So those are things that we break down, and that's kind of where some of these tips will come in and the warm-ups will come in. So moving on to kind of general tips, and we'll get into each of these points. The first thing that's really important is hydration, really taking care of your water intake. And we hear this all the time, we need to drink water, and it's true, but the vocal cords, again, keeping in mind if they're really tiny, you have to be really systemically hydrated if those tiny little tissues are going to be well lubricated for their jobs. And you're not going to really get a good benefit of one glass of water right before coming up here if you haven't been drinking all day or all week even. If you didn't sleep well last night, if you've been talking all day, it's something to think about. So yeah, water, and I would say anything caffeine-free is pretty reasonable in terms of getting good hydration. Milk counts, juice counts, those things are pretty hydrating. The things that we need to be really careful about and use in very small amounts are things that are irritating to the vocal cords, and in many cases irritating to the rest of your body. So the first being caffeine. So yeah, again, I have a 2 and 4-year-old. I'm not ready to have no caffeine in my life, but you know, my 8-ounce cup is very looked forward to, and then it is gone. So yeah, you know, 1 serving is pretty reasonable, I think, across the board. And the other really irritating thing is alcohol. So also fun, but can't overdo that, because both of these substances are drying. They are naturally diuretic. They take moisture out of the body in many cases. And the other problem, especially with alcohol and in any kind of performing arts, so I see this a lot more with singers who are performing late and drinking and eating late, but we lose some awareness when we're drinking too much. We kind of forget to tune into our body. We forget to tune into these things that we know are important for producing a voice. So if we drink a lot, we may lose touch with if we're doing those things well. So yeah. The other, the kind of segue from those substances, another subset of managing your voice is managing general irritants to the larynx. So besides drinking substances or that are irritating, we need to watch out for things like acid reflux, GERD, so gastroesophageal reflux disease. There's, you know, traditionally when we think of that, we think of like heartburn, indigestion, you know, maybe regurgitation, and those things are really serious, and we don't want to ignore symptoms like that. The thing that we're learning more and more is that besides just those traditional esophageal symptoms, reflux comes all the way up, out that upper esophageal sphincter, so that one that is what we swallow into, that actually opens too. And so a lot of people end up getting tiny amounts of reflux material up into their throat. And the larynx is really not set up like the stomach or the esophagus to manage that kind of chronic irritation. So some of the really common symptoms are throat clearing, voice changes, feeling like there's a lump in the throat, so just a constant kind of annoying feeling, difficulty swallowing. So those are things to watch out for. And those are, many people don't have those traditional heartburn symptoms. You know, they have no idea they have heartburn until they come in. Sorry, they have no idea they have reflux until they come in and the doctor looks at their throat and we see evidence of tons of irritation and problems. So reflux is really hard. So even if you don't have reflux out of normal limits, we all do reflux from time to time, and there are things we can do to kind of make sure that we keep that at a minimum. So without going on medication or talking about that, that's when it's medically necessary, and that's between you and your doctor. But in terms of reflux management that you can do every day are things like chewing your food really well. So taking a bite, chewing well. When you do that, you allow your body to mechanically break down the food. Your teeth grind it down. Saliva has some pre-digestive properties, and you're sending a really easy thing for your stomach to digest down the line. If we take huge bites and we eat really quickly, the stomach has this bigger job, and it has to pour a ton of acid on that to break it down. So even if we're eating healthy but we eat too fast or eat too much, we're more in danger of having that food come right back up. We're also, that being said, there's also foods that tend to cause more of an acid production than others. Many are probably aware of. They're all the best things, like chocolate, caffeine, alcohol. Really high fat foods take more acid. Really acidic foods, so spicy food, things like that. So those are things to kind of have in moderation, and it doesn't mean you never have them, but maybe you have that at lunch as opposed to dinner, or if you're eating out late, you have a smaller meal and that kind of thing. Other important thing with reflux is just staying upright after you eat. A lot of people will eat and recline or eat an hour before bed, and you really need more time for food to digest. So just by being upright, you're letting gravity help and keep that food down. So reflux is a huge thing we see. It's a huge part of people's medical history when they have voice problems. So the most that you can do to combat that, the better. Esophageal cancer is the fastest rising in the US, so fun fact. Okay, so in addition to reflux, other management to watch out for is drainage or any kind of irritation coming from above. So if you've got postnasal drainage, meaning just excessive mucus coming down from your sinuses that you feel or that you can see when you look in your mouth, if you're chronically congested up here, those things are going to affect your voice because that drainage has to constantly go down and around the tissues in your throat. It's irritating. So again, things you can do, staying well hydrated will help thin out secretions, things like that, and managing it with your doctor when needed. So, okay, in addition to managing reflux, irritation, hydration, some other voice tips. I want to give you an alternative to clearing your throat. So, throat clearing is really, really hard on the vocal fold tissues. When you clear your throat, those vocal cords rub together like sandpaper. And like I said, they're tiny, they're covered with a skin-like layer. When we do that, it kind of hurts. So if you clap really quick, do that, you'll feel go ahead. You'll feel like a tingle, right? You do it pretty hard. Imagine that you do that, 50 times an hour, maybe once a minute. Some people do it 10 times a minute. So that's really, really hard on your vocal cord tissues. When they hit with that force, they're going to have irritation, especially if you do it chronically. It's kind of like having a callus in your shoe. Your foot's constantly rubbing up against the other part, and then you've got a tissue that's changing. That happens in the vocal cords, and when you hear about people having vocal fold, lesions or masses, that's often a part of that. So not clearing your throat is really, really important. So what I want you to do instead, and we clear our throats for a variety of reasons. It may be that you have some gunk or mucusy. It may be that you're nervous. It may be that you do it a lot and you don't realize you're doing it. So what I would do instead is I would take a sip of water. You want to swallow in a couple different ways. So yeah, you can swallow hard, almost like you're swallowing peanut butter. You're going to squeeze the muscles in your throat and just use a little extra force. I'll do that so I don't clear my throat. So it's kind of a slow motion swallow. When you do that, the muscles that help you swallow, they do that with more force, and they're helping push down any material that you have that you're feeling. The other option, which I think is better, is you take a sip of water, you're going to hold it in your mouth and tuck your chin. You swallow with your chin tucked. So anyone want to try that? When I do that, it kind of squishes everything. It forces me to swallow hard, but it also helps empty out places in our throat where stuff wants to accumulate. So it's a nice alternative. And that's easier said than done. So the first step of trying to stop throat clearing is just noticing it. Telling people around you, your family, tallying it during the day. If you find that you do that a lot, being aware of it is the first step. Then when you feel that initial reason that you're trying to clear, try not to. Take a swallow instead. That will go a huge way in keeping your voice healthy, especially if you notice you're doing it a lot. The same kind of goes for coughing that's outside of an illness. So if you notice that you just kind of cough every day, a few times a day, that's maybe a similar pattern that if you notice it, take some water, see if you can suppress that tickly cough. And if not, again, that might be a sign that you have an irritant going on that you want to look at. So, other tip is watching out for how you use your voice day in, day out. So just examining your life and how you talk and when you talk. If we talk over background noise frequently, that's really hard on the voice because we tend to be pushing and we don't realize we're doing that. So if we take a lot of phone calls in the car or we have a lot of meetings out in a crowded coffee shop, It doesn't mean you can't do that, but it's likely that we're talking at a volume that's too loud. And if we do that over an hour, over 3 hours, our vocal folds and the muscles surrounding are going to get fatigued. So we'll talk about that a little more later, but that's something to watch out for and to just be aware of. The other thing is just using our voice in really extreme ways. So yelling, screaming, pushing our voice in any way. For sports fans, or we have grandkids or kids we're running after and we're, getting spirited with them or mad at them, we have to be careful. Even pets, I see a lot. People are just yelling for their dog all day, and it's hard on the voice. So when you can, using alternatives, so just walking up to people instead, saying, "What do you want for dinner?" Instead of yelling across the house. Things like that. Just being aware that doing that too much will be hard on your voice. And so the other thing that I see a lot is people not warming up. So that'll be a good segue into this section where I want us all to try this. But there are several things you can do just daily in very short snippets that are really helpful for the voice. The first one is not everyone can do, so we'll modify this if we need to. But it's called a lip trill or a raspberry. You've probably heard it before. You take a nice comfortable breath and you just so everybody do it. We're doing it like 5 times, so take a few minutes. And if you're having trouble, you may push on your lips a little bit in. Does that help a little bit? And what you're listening for is good effort. You're looking for floppy lips. So if it's hard or it's coming out tight, see if you can make your lips really loose, like a horse, like lower your. Think of a slide. Good. So you'll notice that right now when we're doing this, we're not really making sound. It's just air flowing, and that's a really good first step. The more that you get the air going, the easier that's going to be. So try a nice slow breath before it starts. It's going to take some practice. Yeah. Okay, now for those of you that are getting there, let's try it. You're going to do the same thing. You're going to get those lips flopping, but you're going to add your voice to it. So now we're going from vocal cords that are open to bringing those vocal cords together. So give that a whirl. Yeah, it's hard. Like I said, this is a hard one, so it takes some time. If you're really struggling, you can do tongue out. Or if you can't do this, you can lip or you can tongue trill, like some people can. It's okay. Full tongue. Yeah. So that's one option. I like these because they're hard to do wrong. For those of you that can't do it, you'll notice it doesn't really happen. So it's hard to do this with tension, which is what I like. It takes some practice, so that's something we can try. Another one which is easier is I want you to just hum, kind of in your speaking voice at a comfortable pitch. Okay, now do that again, and this time I want you to tune into, do you feel any sensation anywhere in your body when you do that? Anyone feel anything they want to yell out? You feel it in your
Back
throat?
of the throat.
Okay, throat, top of your head.
Bridge of the nose is vibrating.
Bridge of the nose. Cool. Good, okay. So just like if you're standing near a piano that's making noise, or really loud bass, we're going to feel vibrations. Our vocal cords, when they come together and they make that vibration, like I said earlier, that travels through our body, and that ideally is going to bounce off structures in our face. So you were feeling it in your throat. What I want you to do, what I don't want is only throat. If you're feeling kind of work here, that's telling me that your muscles in your throat are squeezing in a way that isn't allowing that air to really travel out. So do that again, and I want you to take a maybe bigger breath. Maybe explore. You can go up in pitch, down in pitch, louder, softer, and yeah, anywhere north of the throat, and sometimes lower is fine too. Really good humming. Did it change at all?
Let's wear more here.
Good. Right. So when you do this at your leisure, try to aim for some kind of facial vibration. If you're doing this and you're feeling really throaty, or it's sounding and feeling effortful, that's not going to be helpful. If you're getting some air that travels all the way up and out, you should get some slight vibration going on. So now, same concept, do that, but we're just going to go up and down a little. And you should feel vibrations as you go. And then, so we're really exaggerating, which is good. You can also do it more of like a spoken We did this one. Yeah.
The nuggy sound.
Yeah, yummy, exactly. So, say the word, now that you got a little bit of this idea, let's just say the word mom. And I want you to see if you can feel it in a word. Mom. You got the tickle going, it's kind of a little ramp into the rest of the word. Some people are feeling that? Good. Now say mom without thinking. How do you normally say that?
Mom.
Mom. Everyone kind of dropped down, right? This is why I have a job. It is really hard to think about using air and letting these things happen in our day-to-day speech. We're busy, we're thinking about other things, but a little warm-up like this is a really good way to almost calibrate a mental and a physical place that you know a really good voice comes out. So if you go up a little bit, you find, oh, that's easier. Or for some people, going down a little bit. You want to aim again for where you're feeling tickle. And if you think of that as kind of a launch pad, yeah, sounds good. I'll be there at 8. I don't know. I'm not sure. If I only talk here, which of course I do at 9 o'clock or whatever, but if I stay there all day, my vocal cords rub together the way they do when I clear my throat. So those 200 times a second, we talked about the vocal cords vibrating. If we're not using air and we don't feel tickle on an M, for example, those vocal cords are hitting like this 200 times a second. And so that's a really chronic thing too, that people will come in, they'll say, geez, I don't know what's going on, but my voice is getting really low, it's cracking, and we look and they've got big bumps right in the middle of their vocal cords where they're hitting all the time. So getting out of that place that we maybe default to is good to think about. I kind of call it the difference between like a on-purpose voice and a voice that's maybe our default. It doesn't mean we never, land there sometimes, but most of the time we should be feeling like we're having a really smooth, clear voice, and when we hit a sound like an M, we would hopefully feel that. Now, of course, we don't speak in M's all day, so we'll talk about speaking voice kind of techniques in a minute. But in terms of warming up, so lip trills are an option, M's are an option. I want to try a different glide, since lip trills were hard. When we glide up and down in pitch, your vocal cords lengthen and they shorten. So it's kind of like our other muscles. We need to stretch, just the way an athlete would stretch before an athletic event. We need to warm our vocal cords up. They literally increase in temperature, so there's more blood flow. The tissues get warmer. They're less likely to have injury. And there's so many delicate blood vessels in our vocal cords that we don't, again, want to bang them together and hurt anything in there. So, in a sense, when you stretch and when you glide, you're really letting those vocal cords move around, and we need them really mobile to be healthy. So let's try this. I want you to make a sound like a V. And when you do that, I want you to listen for almost like an F sound with it. It's a really buzzy, tickly V. Yeah, so now, good. to move your hands. It's really helpful. Yeah. I would say only go as high or as low. Yeah, do you have a question?
When it is short, when is the vocal short and when it is long?
They're long when they're higher pitch, and they're short when they're lower pitch. Good question. So yeah, the thing to be careful of when you do this is you don't want to, you know, at the bottom. We need that F sound the whole way through. Because that's a sneaky way of getting you to use air. That's a little safeguard. So a little bit of that before you speak. Obviously you're not going to sing or speak in this big range, but your vocal cords need to move just like our other muscles. So yeah, some gliding, lip trills, M's. The other thing I didn't talk about yet, which is more related to the rest of your body, is stretching. So when you think about speaking or singing, a lot of times you'll hear about good posture. And I think posture is a little bit vague. It's like, is this good posture? You know, it's very subjective. I'm not always sure what people mean. So when I talk about posture and being in a good body position, I like to think about alignment. So sitting in your chairs, we'll start in your hips. What I want you to do is sit in a place where you feel like your sit bones, as they say in yoga, they should be evenly on your chair. Maybe move around a little as you do that. You should feel like pretty sturdy, that you're aware of yourself in the chair. And in terms of, so that's kind of the bottom of you. When you're seated in the chair, we don't want our hips too far back or too far forward. So think about getting to where your hips are neutral. So if you're leaning back in your chair, you'll probably have to sit up and engage your core. So go back and forth a little bit, and you may see what I'm talking about. Like if we're really far back or we're kind of slouchy, the hips need to be pretty neutral. And yeah, if we are in that position and you feel your tummy, you'll be like, oh yeah, okay, this is working here. If we're not, it's not. So we need these big muscles to do the job of holding us up. If we don't do that, the strain is often right here, you know, even just little bits. If we're on our phone or we're in the car or the computer, our neck takes a lot of the weight of our body. So when you engage from your hips or your feet, if you're standing, so same concept, you kind of want to be upright. So again, hips are neutral. From there, you want your ribs to be directly over your hips. So if you think of the hips as a bowl, the ribs should fit right on top. So many of us hang out somewhere else. And again, that's going to include this working. From there, like I said, last step is just kind of bringing that chin up a little bit so that we're not pushing out. Now, of course, in storytelling or any kind of performing arts, there's ways you're going to move your body that are choices and part of your performance, and that's fine. But again, I think I'm talking about the day in, day out way that we sit in our car, sit at our office, sit in our house. We need to be engaged in our body to do that well. Okay, so once you're in alignment, this is a really good way to ensure that when you stretch your head and your neck, that you're getting the most effective stretch. Again, if we're not in a comfortable place and we try to stretch, things are already squished. So sitting up, first thing I want you to do is just drop your head down, and you're going to go as far as you can and feeling a stretch maybe along the back of your neck, maybe even between your shoulder blades if you can. And once you're down there, I want you to make sure you're breathing. So many of us hold our breath. So just, yeah, actively breathing. And now that you're there, just rock your chin back and forth, a little tiny roll. And you may notice somewhere along that spectrum, it's tight or uncomfortable. And I would really just imagine breathing into that area. Give that area a little bit of attention. Maybe you need to stretch a little longer in that section. But yeah, this is a really nice stretch to do, again, any time of day, but certainly a few times a day wouldn't hurt. And I like to, when I'm stretching, I would say stretch for 10 to 15 seconds, and I count it by breath cycles to make sure I'm not holding my breath. That being one. So doing a nice long stretch is really good for you. Okay, so that's what I call the yes. Next one is the no. You're gonna start neutral again and then just turn to the side. You're gonna go as far as you can while feeling a stretch on that outer shoulder and neck. And then, yep, the other side. So we're just, you may feel one side is easier than the other. And if you're really flexible sitting in your chair, you can put your opposite, so your left or your right hand on your left leg, and you can even, twist a little bit just to get a little further. So when you're already really comfortable, getting a good stretch in. The other thing I would say to save you time is you can do some warm-ups while you're stretching. That kind of thing. Kind of integrating that as you move your body. Good. Yeah. I hear that voice. Good. Okay, so that's the yes, the no, and then my favorite is the maybe. I don't know. So you're just tilting your ear to your shoulder. That's usually a big one for people. And in this position, once you've done a couple breaths here, what I like to do is you can drop your jaw and nod. And that will usually make it a little more intense, especially for those of us that clench our jaw or maybe, carry tension up here. Yeah, other side, same thing. You're just tilting ear to shoulder and then dropping your jaw and nodding. So that should feel really good. Yes, no, maybe. If you do nothing else, yes, no, maybe. It's a good neck stretch. In general, other stretches, just, body up here, front, back, moving around. Even if you're just touching your toes every morning, get your body moving a little bit. It's really hard to have a super healthy voice if we're not taking care of our cardiac health. We need to have some energy. So within reason and within what you can do some easy walking, easy, again, just moving around in your own house if you need to. That will really help you not carry tension up in your muscles here. So we talked about kind of how the vocal cords work, irritants to manage, not yelling, not throat clearing, doing some warm-ups. Another warm-up I'll add, and these are kind of along the lines of that glide we did before, something I call the yawn sigh, and I didn't make this up. Yeah. So do it again. You make a yawn kind of posture. You really add your voice into that space. One more time, maybe higher. Feel free to go low. Yeah, and one thing that's common that I'm seeing is keep your mouth open the whole way. Yeah, it might make you yawn. That's okay. Keep your mouth open the whole time. Instead of a lot of people do that. So just, again, really getting your voice moving. Okay, in the last few minutes, I want to talk about, you've warmed up, you're taking care of yourself. Yeah, question.
How much time before we say perform should we do this stuff?
Good question. I would say two-part answer. So for your day-to-day talking, which I think is just as important as your performing, I would do it right before, 10-15 minutes before you really start your day. So if you're on the way to work in the car, sitting upright, do some warm-ups. That's going to help you the rest of the day. Especially because most of us, if we're doing something with our voice, it's in the evening. So when you go to perform, I would say a good 10 minutes before, just so you've got some time. But warm-ups could vary 5 to 20 minutes long. The longer the better, probably. Not longer than 20 minutes. You don't want to exhaust yourself, but enough that you're just like you would be before an athletic event. You really want to give all your muscles some time to kind of get going. It's like people jog a little bit before they maybe sprint or, whatnot. Yeah. So definitely doing it when you think you don't need it is important. And yeah, so in terms of speaking, okay, you've warmed up, you're stretching, you're exercising, you're trying to eat well and not have reflux-inducing foods. You're stretching. These are really good for if you're stressed out. I didn't talk too much about stress, but it's a really driving factor of when people come to my office, they are struggling to manage a lot of things in their life. And usually, we hold tension somewhere when we're stressed. So, we can hear it on the phone when somebody's not upset, are you okay? You sound, no, I'm fine. Like, you don't sound fine. We usually hold it here. Many of us either hold our shoulders up or we hold our breath a lot when we're thinking about something we're worried about or we're in traffic. If we're chronically holding our breath, those vocal cords are tensing a lot and the muscles around them are tensing a lot. So being aware of that's big. And okay, so you've done these things. You're trying to be in a good place. You go to speak. What are some things we can do? The first is really, really common. I think this is something everybody can do, and many people aren't aware of it. Once you realize this, it'll be easy to fix. But many of us take a breath, we start talking, sounds pretty good, but then we don't take a new breath, and we just keep going, and we're so excited, and we're just telling you about our weekend, and like, I still haven't taken one, and I'm going on, and it was so funny, and I sound fine. I still haven't taken one, right? I can go and go and go. And if I do that, like a lot, I'm not letting air pass through my vocal cords. They are squeezed together by the muscles in my throat. So intentionally, taking breaths when you talk is really important, whether it's conversationally or in a, again, work situation. Make sure you're refilling. Just replenishing breaths is huge. Make sure you're taking a breath. Specifically when it comes to a story, practice where you're going to breathe. I would consider trying it a few different ways. See where you naturally breathe and see if you need any more. Are there places in this story that you're chronically feeling like you're out of control or that you're uncomfortable when you're doing it or the voice doesn't sound like you want? You may need another breath. So breathing when we talk. The other thing is, so we take in air. We want to inhale, but when we exhale, that's when we speak. So exhaling with sound, as my friend Megan would say. We want our voice to come out as we exhale. So when we do that, if we could sneak in a little bit extra of the consonant sounds, so things like S, F, Sh, Z, Z, these especially flowy sounds, it's a sneaky way to get me to use more air when I talk. So if I say, okay, yeah, I'll see you Saturday, I'm gonna bring fish over, I think we'll just cook it on the grill. Okay, I didn't really pay attention to my consonants. It didn't sound that bad, but it didn't really feel good in my throat. If I do that again and just give 10% more attention to those initial sounds, yeah, I'll see you Saturday, I'll probably bring fish over and we can just cook it outside on the grill. It still sounds normal. I don't sound like a robot and hitting every single one, but focusing on those sounds, that's a sneaky way to get you to use air. Instead of using throat muscles, you use air. So, so the other thing I'd like to say, and I think, like I said, many of you are probably not having problems when you're up here performing. When we're here, something happens. We're on stage. If you're here, it's probably because you get that buzz, right? You want to share your voice with people. So I really love when I'm an audience member and I'm listening to people perform. I love when they do some of these things wrong, but on purpose. Okay, so say I'm telling a story or singing a song. Some of my most famous folk singers are just like the tiniest bit hoarse and crackly at the end of their phrases. And I get this sense of like, they're human, they're a little bit broken, they're a little bit, in need. So if you're telling a story and you want to make something like that clear at the end of a phrase, do that. Tighten your vocal cords a little bit. Get a little breathy, like fine. But do it on purpose, and maybe don't practice it 20 times in your most gruff, loud voice ever. So you're allowed, of course, to make these like human choices and to communicate real things. Your voice doesn't need to be perfect, but it needs to be healthy. So thinking about, again, these things I've said really mostly apply when we're not up here. This is maybe 5 minutes long or an hour long, depending on what you're doing. It's all the rest of your day that you're talking and maybe not thinking about it. So again, I would warm up, even if you don't have a gig that night, warm up, use some of these techniques. And then when should you come in? So say you're, feeling like you're having some voice changes or some voice difficulty. The prevailing wisdom would say about 2 weeks of a voice change that isn't getting better, you should come in and see a physician. Usually an ear, nose, and throat physician. If you can, go straight to somebody that can look at your vocal cords. And I brought my cards, I think, tonight, but if not, I can get that information to you. Because you may have a cold, you may have something that's not a big deal, or you may have something else going on, and you don't want things to go on a really long time and then have, more work to do. So any voice change that's happening over 2 weeks, or if you have a really sudden voice change, like you're at a soccer game and you're yelling and your voice stops and now you can't get your voice out, you need to go to the doctor much sooner. You can actually hemorrhage your vocal cords. So if you hit them too hard, those blood vessels can bleed into the vocal cord, and it's not good. So that's what Adele did, for the record. Sweet Adele just sings hard, and for so long, and touring schedule, she had a hemorrhage. And obviously got it taken care of, thankfully. But yeah, so that being said, you may not have a major issue, but you want to improve your voice, or you're finding like, I'm pretty good, but I'm getting really fatigued at the end of my day or the end of my work week, and I can't really recover enough, and I have to push my voice out. Any of those things are kind of red flags if you're not overcoming those on your own. And again, I'm a speech pathologist, and I work with 99% of the patients I see have voice problems. So it's a really common thing, whether you're a teacher or in healthcare, business, and again, sometimes parents who are just talking to their kids all day, it adds up. I'll open it up if there's any questions. Yes. That's okay.
Sorry.
Now I'm like the throat clearing police. It's okay.
On the subject of irritants, you mentioned hydration. You made me recall when I was a wee nipper, a singing voice coach said, never consume orange juice or milk an hour before you perform because it makes you phlegm up. I'm sure that's not an exhaustive list, but those pop into my head.
Right. I do think that is individual, but I hear many people say the same thing. Both of those things that I'm aware of don't really create mucus, but they coat mucus that you have in your throat. And the secretions that we all have that are kind of draining constantly are going to be coated by that stuff. And then, you may feel a little more phlegmy. If you do have reflux, though, for some people, orange juice is something that may trigger reflux. And mucus actually is a symptom of reflux. When you have constant acid coming up, your body creates more mucus to kind of buffer it and say like, ouch, that hurts. So yeah, again, certainly not an hour before, but if you're noticing that constantly happens to you, it's irritating, I would get it checked out. Yeah. Sorry, go ahead.
2 quick ones. My physician, because they don't want to use antibiotics, is always saying Mucinex DM, so I'm using that a lot. You're trying to stay hydrated. Is it basically canceling that out, or?
That's a great question for a doctor. I don't know 100% how that works. What I hear around the office is that the D specifically is the really hard part about Mucinex because of that whatever combination of drugs is there. So yeah, I mean, if you're working a physician on with the physician on that, and you're really well hydrated, the other thing you could consider is some external hydration, like a humidifier, or especially like before something like this, just breathing in some steam, like those little personal vaporizer things. You can get them at CVS. I wouldn't put any Vicks in there or anything that comes with it, but just taking some extra air on to lubricate kind of from the outside in. That's going to be more of a temporary help, but yeah, I would ask your doctor if you're concerned about the drying, and maybe even like the laryngologist I work for, he may have a lot of options in his toolbox versus like your PCP.
And
I'm
then
not sure.
just real super quick,
Yeah.
on the lip buzzes, or we used to call them raspberries.
Yes.
Motorboats and raspberries, but if you find that you could do the raspberries for a long time and now you can't, is that a symptom of anything?
I think maybe of kind of deconditioning, the way if you haven't been running for a while, then you try to go out, you may feel like you've lost a little bit of endurance, but a really easy way to fix that would just be to start with a really high quality one. So as long as your lips are flopping, you get a green light to keep going. Great, that's gonna be better than really pushing. So the more you do it, I'm
Okay.
thinking you could probably build back up. The same goes for some other sounds, so we could talk after, but
Okay,
yeah,
thanks.
good question.
Actually, one question came up from what he said,
Yeah.
but there was a question before that, which is your tonsils.
Mhm.
Do they benefit your vocal cords by being there? Unfortunately, I was at a time when, smoking, I didn't smoke, but in the household there was secondhand smoke.
Sure.
And they didn't understand that that was the first line of defense. It was like, oh, well, if you're getting a sore throat all the time,
Mhm.
we need to have these removed. So I'm
Right.
wondering whether that compromises my vocal cords or helps or changes the sound, or...
It does change the sound, just in the simple fact of kind of if you were in a concert hall and there was a big curtain over the stage, that the sound in the room would carry differently than if there were no, materials in there. You know what I mean? It would echo a little differently and bounce around. It certainly doesn't, I think, hurt in the sense that many people have to have them removed, and that sound still can travel out really well. For some people, it's a detriment, and they're so large that they're really blocking the sound from coming out. But yeah, if that was a long time ago, I'm
Yeah.
guessing that you're okay.
The other thing I was just thinking, I have a steam
Mhm.
shower.
Yeah.
So if I wanted to, as you say, externally hydrate,
Right.
putting that on and sitting in there
Sure.
would be a good way of doing
Yeah,
that?
a little extra long, yeah, like
Okay.
10 minutes. The main thing with any kind of outside source like a humidifier or showers, keep it really clean. If we're breathing in mold, that's not going to be beneficial. And a lot of people don't clean their humidifiers, and even if you do, again, maybe replacing them every year just to be sure is probably a good idea. So yeah, like within reason, but certainly.
Okay, no, I just never even thought of that.
Yeah, it's a
until-
great idea, yeah. Any other questions? Yeah.
If you have repaired or injured rather your vocal cords, not like Adele, but I mean, if you
Yeah.
have,
Yeah.
do they repair? Do they, if you stop doing whatever it was you were doing, is there a natural repair, or once they're damaged, are they damaged?
It depends on what happens, but yeah, say you're sick and you're coughing a lot and you're hoarse, right? And you're really got a rough voice. That's a sign that there's swelling going on usually in your vocal cords, and that resolves itself as your illness improves. Say you yell really loud and you do have one of these events where your voice is gone. If a couple days later it's coming back, then you're at a good sign. But there's a lot of different reasons people come to me. You can have bumps or lumps on the vocal cords that kind of form as a result of different things. You can have weakness in your vocal cords, so they may not open or close like they should. Maybe only one side opens. As we mature and age, our vocal cords can thin a little bit, so instead of perfectly coming together when they vibrate those 100, 200 times a second, there's sometimes a little gap between them as those tissues thin. That's certainly something you can overcome, usually with therapy, just making sure you're really working your vocal cords out, that can improve. But yeah, it kind of depends on the injury, but certainly something that's more related to our normal physiological processes like coughing, or maybe you were vomiting a lot. Sometimes that'll hurt your vocal cords in some ways, but yeah, they definitely have a natural healing, just like our other skin and tissues. Yeah.
I don't know if this has anything to do with it. Is there a beneficial way of sleeping to help you with breathing, or?
Great question. In terms of managing your irritants, yes. So for breathing and for reflux, it's usually recommended that people sleep at a slight incline if you can tolerate it. And that would
Tell me again.
Oh, sorry. So at an incline, you want the head of your bed maybe 6 inches higher than the foot of your bed. And the reason is, again, gravity is going to help keep your food down, keep you from having gunk coming up all night. And for those of us who have like snoring or apnea stuff, maybe that's mild. It helps you usually breathe a little bit better. But I would say, that being said, if you're apnea is a little different. I wouldn't ignore if you're having, chronic fatigue every day and a lot of snoring that your partner notices, things like that. That can be a sign of not breathing at night, which you don't want. But again, if you're sick and you're really congested, being upright will help you drain a little bit better. And they have all sorts of crazy pillows and things for reflux, and I would say just being careful that you're at a slight incline. A lot of people think, cool, I'll just bump my head up, and then they sleep like this, or like this. They're like compressed all night. So you want to be your whole body should be gradually at an incline. Yeah.
For singing, a lot of us as we get older, our vibrato gets much broader. Are there exercises and stuff, or is that just the vocal folds getting
I
thinner?
think definitely. I think vibrato that becomes kind of out of your control is usually a sign of some breath instability. So just working with maximizing the air that you have coming out is a really good way to do that. There's all sorts of little things you could try, but many of the things we've done, I suspect that as your vocal cords kind of do these exercises, they do tone a little bit. They get a little more, taut, and that helps them come together and produce a more clear sound. But yeah, vibrato can be a sign that air's kind of escaping irregularly. And it can also be a sign of tension. I can really make a vibrato happen versus it naturally coming out. So it's a tricky subject, vibrato. I'm not an expert for sure, but yeah.
So
I'll hang out for a bit. Yeah, I was just going to say.
what about you talk mainly about vocal cords. What about your mouth and the voice that comes out, the sounds that come out?
Yeah.
Can you tell about that more?
Yeah, so when I said that when you're speaking, you should really be thinking about consonants, so the S, the F, that's one way to think about that concept. I often start there because I don't want people to think about 100 things when they're talking, like take a deep breath, stand up straight, open your mouth, it's too much. If you think about consonants a little bit, that can help. But certainly I see a lot where I need to work with people on just simply opening their mouth when they're talking. They don't realize that they're just, doing this. And so it's certainly good to open your mouth, to focus on the shapes that you feel when you produce sounds. But yeah, that could be a really long answer. So I'll leave it at that. Any other questions? I'll hang out for a little bit if you all want to talk off the stage.